Good afternoon. My name is Christina Kapothanasis. I am the hostess of Traditional Chinese Medicine. Today we are going to talk about different types of coughs. Everybody's experienced coughs now and then, and today I would like to share the Chinese medicine analysis of those coughs. I am a licensed acupuncturist here in the state of Hawaii, and I am nationally certified under the NCCAOM National Certification Commission for Acupuncture and Oriental Medicine as a diplomat of Oriental Medicine. I'm also the executive director of the Hawaii Oriental Medicine and Acupuncture Association. So thank you so much for joining me again today. And when you think of cough, you may think of several different types of coughs. There's coughs associated with the common cold, and there's coughs associated when they get deeper into the lungs, associated with bronchitis, acute or chronic. It can turn into COPD. It can manifest in emphysema or more severe things like cystic fibrosis, where people are coughing up gobs of phlegm, and then even lung cancer. So different coughs associated with different kinds of diseases. We will still use Chinese medicine, the kaleidoscope of Chinese medicine, to diagnose a cough. And we try not to use the Western medical diagnosis to limit our treatment. I know that in Western medicine, different coughs are caused by different agents like bacteria or virus. It can be chemical or environmental allergens, or it can just be aspiration of fluid or different things into the lungs that cause the inflammation and spur the cough. They are usually treated, as you well know, by decongestants or cough suppressants. They may treat you with antibiotics and or resort to the use of prednisone, the almighty prednisone, which I would really like to help you avoid. So in Chinese medicine, no matter what Western medicine diagnosis you're given, whether it's acute, which means you've had it only recently, or it is chronic, where you've had it for 20 years, we can still diagnose with Chinese medicine according to a complete symptom intake and the extraordinary help of your tongue and pulse diagnosis. So we are going to look at symptoms that are associated directly with the lungs, like the quality of your cough and the quality of your phlegm. But we're also going to look at other symptoms like your sleep and your stools and your plenty of different symptoms that may not be directly related to the cough in Western medicine, but will help us tremendously in giving you a very specific diagnosis. Some of the main syndromes or classifications of cough that I see here in Hawaii are we say feng re. It means that the exterior has been infected with wind and heat, and that is usually exterior wind heat usually translates into common cold, flu, or conditions like this, which are a little bit more acute. Then I also see usually it gets to more chronic or serious infections or diseases that are more concentrated with the phlegm. So 痰湿 is phlegm and dampness, and these conditions can be, even if you're looking at something that's gone on for a while like pneumonia or bronchitis, or if we're getting into different chronic diseases where you're constantly coughing up phlegm, and sometimes there may be no pinpointed diagnosis, but you just seem to have a lot of phlegm that you're coughing up all the time. And then the other big category that I see is the yin deficient people. These people usually have more dry cough. So these three different ones, whether it's the heat obstructing the exterior, or you have a lot of dampness, whether it's hot or cold inside, and then the third one I see a lot of is the dryness, extreme dry, call that yin deficiency or lack of fluids in the body. These all can have underlying addition of kidney deficiency and this is something that can be added on to a main diagnosis. And if that is the case, we will see that with different symptoms, and that will tell us which herbs and acupuncture points we need to pick. So if we went down and divided them up by symptoms, we would see that the heat in the exterior, the common cold symptoms, may include, everybody's very familiar with, cough and possibly productive cough. The phlegm may start off clear, then turn yellow, then turn green, and then come back to yellow, and then come back to clear or white. And it can be watery, but it usually, when it's yellow, it turns into sticky and or nice little globs of green chunks that come out. You may have, at the beginning, the chills and the cold sweats. You may have headache, and your eyes may be particularly sore. Your joints may ache, and it might just start off with an itchy throat. It might develop into a sore throat, and your bowel movement may or may not be affected. So you may have nice formed bananas, as I like to joke, or they might turn loose like applesauce or a little bit firmer. A lot of these kind of colds or flus are caused by maybe the germs in the air, bacterial virus, but usually it's that the digestive system is just not strong enough to fend those off. So I say that colds are usually digestive colds, which means, for example, a lady was traveling, she was stuck in the airport, and I'm sure many people were coughing, but she's traveled before and hasn't got sick. And what was the difference this time? She didn't have very much to eat, so she picked something that has spicy sauce on it, which she does not tolerate well. And that spiciness damaged the fluids in her digestive system. She's already an inefficient constitution. She's a little bit tendency towards dry. And then this dryness in the large intestine was reflected in her lungs, and then she came down with the common cold symptoms. When we look at the tongue and the pulse for this exterior heat, we'll usually see that especially the digestive pulses will be a little bit more slippery or possibly weak, depending on if they had loose stools in the past few days. It usually goes like this. Progression, day 1, you eat something that probably doesn't agree with you. Pretend you had an ice cream or cheesecake when you have been close to dairy-free for quite a while. Then the digestive system shows possibly the next day or the third day some kind of irregularity. Maybe you feel a little bit bloated, or you have loose stools, or some kind of gassiness. And then maybe here on the next couple days, you start developing an itchy throat, which turns into sore throat, which turns into yellow mucus. And this is how you can always think, what did I do? What did I eat? If you're stuck in the rain and you get a cold, hopefully it's going to be better if you have a stronger digestive system. That's why we put so much emphasis on the food that we eat. The people that have the excess of dampness, these people may also have a spleen deficiency. Because if it's been chronic for so long, then we know that there's some kind of digestive weakness going on. The spleen is responsible for making the phlegm. So spleen and stomach, in other words, our digestive system, makes the phlegm from the foods that we eat, and then it just comes up and dumps it into the lungs. The lungs are the containers for the phlegm in Chinese medicine theory, and they are not creating it by themselves. It's the digestive system that's overflowing into the lungs, and that's how we spit it up. So these people may have copious amounts of phlegm and or not. They may have a little bit of phlegm that they cough up every morning, or they may be coughing it up all day and all night long and not be able to sleep. It can be any color. It can also be tinged with pink or dark brown, which may be some fresh or dried blood. And these people maybe have chronic loose stools as well, or sticky bowel movement, which just means you have to wipe a lot. I know people love to talk about the bowel movement. Tongue and pulse is the easiest way to diagnose these people, because you can often see the digestive inflammation and or weakness in their pulses, but the telltale sign will be their tongue. Whereas in the common cold, the tongue may be normal and the digestive pulses may be slippery, or all the pulses may be slippery and very hot to the touch. In the dampness, you'll see a thicker tongue coating. It may be thick yellow, it may be thick white, it may be thick with dry cracks in it. It can be anything, but the thicker it is, the more dampness we know we're accumulating in the digestive system, which is going to be trapped in the lungs, and it's not going to let us rest. So we would look at these people and definitely need to see the tongue and the pulse. That's the most important thing for diagnosis in Chinese medicine. And yes, the tongue and pulse can change over time, and you can watch it every day. You just wake up in the morning before you brush your teeth and stick your tongue out, then you'll be able to see. It's nice when you can see the difference as you heal. The people with the third type that I was explaining, the Spleen Deficiency, those people will usually have dry cough. It may sound like they have a deep congested cough, but it's more rattly sounding, like the phlegm is stuck to the inside of the lungs, and it's not easy to expel, like the damp cough would be. So these people may feel the sinus pressure where they can't blow their nose and clear the phlegm, or it may just be stuck in their throat, or maybe deep in their lungs. But in any case, these people can have a kind of cough, or it can sound like it's a deep congested kind of cough. And if we are diagnosing these people based on their cough alone, you might be tempted to give them herbs that dried out the phlegm in the lungs or the spleen, but that would not be the right case. One lady recently came in and she had a congested cough, and so she tried to drink soup because she thought that would be good for her. So she drank soup with what inside? Tons of garlic and onions and ginger, and she put ginseng in there. Do not take ginseng when you have a cold. That is for boosting weak people, and this is not exactly the time when you have copious amounts of yellow phlegm that you need to be boosting. It's very hot. Some people, if you take too much ginseng, it's so hot they can have a nosebleed. Garlic and onions and ginger are fine, but when used in large amounts, they are still hot and warm. So this poor lady was trying to drink a lot of soup to help moisturize her lungs, but she said she was getting worse and worse, and she didn't understand why. When she had a bowl of stir-fried vegetables, she felt so much better. She felt that that tasted better and went down better because she was burning off all the fluid in her lungs, which she really needed to hydrate so that she could actually expel the phlegm from the lungs. And I knew this because I took her pulse. And what's the difference in her pulse? It was super thin and dehydrated. So her pulses were thin, and her lung, spleen, or stomach, and large intestine pulses were all very weak. We need them to be nice and plump and soft and full, but hers were thin like a thread, and when you press down, they give out a little bit. They just don't have as much strength to withstand the force of my fingers. And when we see that, we know, this person is extremely dry. So we needed to give her first a formula to pour as much fluid and hydration and cool into the lungs as possible and help her quell the cough until she could be moisturized enough that we could actually help her expel and dry up the phlegm. So it is a progress with the coughs, and if we didn't see that, and her tongue that had very little coating and was a little redder, the tongue needs to be pink with a thin white coating. The redder it is, the more hot she would be, just like when you're dehydrated. You may feel hot and flush and thirsty, and then the coating, that dampness, idea of dampness, would be very thin. So we definitely would want to give her an Urshin the Yin formula and not a soup with tons of ginseng and garlic and onions and ginger. But now she knows, and that's what we're here for. We try to teach everybody. The people with the diagnosis that can be attached on to different other main diagnoses would be the kidney deficiency. So these people usually also have more chronic conditions, and this is because possibly their cough has kept them up night after night after night for months or years, or it's just drained their energy because they're always coughing, and or they're eating a diet that isn't ideal. So these people, when they walk up the stairs, they may feel out of breath quickly, especially if this condition comes and goes, it wanes. Sometimes their cough is very severe and the phlegm is extreme, and then sometimes it lessens and they feel a little bit better. But whenever they walk up the stairs, they have a little bit of time catching their breath. Or even if they're sitting there, they may be very shallow breathers. And other people have described that they just can't seem to take a deep breath where their lungs fill to full capacity like this. They gasp and gasp and gasp, but they just can't seem to fill up their lungs and push them down. And we say that that is the kidney deficiency. This symptom can point to that, but we always need to look at tongue and pulse so that we can see. So what would be the significant tongue and pulse signs? We would look on the left in the last pulse here, and we would see that the kidney pulse is very weak. So if I see kidney pulse is very weak with these chronic cough patients, I definitely need to hurry up and boost their kidneys so that we can get more oxygen into their lungs and they can heal a little bit faster, in addition to taking care of their dampness and or their dryness. Sometimes these people will also have a slightly purple tongue, because if their oxygen is not enough and or if their circulation is poor, then that will show up in the purpleness of the tongue. We have so many exciting herbs that we can use for coughs, and most people that know me know I got into Chinese medicine because my mother had chronic bronchitis when I was growing up. So I have an affinity for any kind of respiratory issues, and I'm very familiar with people who are coughing up yellow phlegm and the sadness that comes along with that. So I have brought a selection of some of the herbs that I would use in different people's formulas today to share with you. Stopping the cough and helping people sleep through the night is definitely one of the issues that we need to solve so people can get better ASAP. I might use an herb like Bai He, which is taking down the heat. It helps quell the cough and it nourishes the lung yin. So we usually have to nourish the yin. We have to hydrate enough so that we can take care of the phlegm. Because like I said, if we just take care of the phlegm, it's going to turn into sticky glob and it's not going to expel. So we're something like cleaning the dishes. We need to run water over the dishes while we scrub and get rid of the oil. So if we just add a dry sponge to the pan, it won't work as well as if we add moisturizing water, if you can understand it like that. So we would use Bai He. I would also use Xingren, which is, it's almonds, but it's a little bit different than the almonds we eat in the store. So we would use Xingren, and that's excellent for transforming phlegm and stopping the cough. And Ziyuan. This is an excellent herb that has the moisturizing qualities and also can help stop the cough. For people who do not have high blood pressure, I would use Sen Gan Cao, which is licorice. Some people are allergic to this and their blood pressure can go up, so we have to be careful with this one. But this herb is excellent for not only giving you a little bit of your energy back, but also helping to stop the cough and helping to detoxify the body, because we need to detoxify the inflammation that is caused by the cold. This herb is called Huang Qin. It is one of my favorite herbs to use with any kind of respiratory problems. Huang Qin is a slightly bitter, but to me it tastes a little buttery herb, and it is Ching, it is Kuhan, it's cold and bitter, so it's going to help transform the phlegm. And when we put it in conjunction with this twig back here, this is called Cai Hu. This is excellent for taking down the fever and expelling that exterior that we talked about at the beginning, the heat in the exterior. It's wonderful for detoxifying. It raises the energy up. It's a fabulous herb that I use for many things, and Cai Hu and Huang Qin together are excellent for colds. We also offer patients a powder form of a more basic cold formula, and I call that a powder pack, a cold pack in powder. So the first sign of a cold, if you have itchy throat or sore throat, or if you have children and they come home and they're sneezing and coughing all over you, or you have coworkers that are starting to sniffle and sneeze, instead of holding a handkerchief with essential oils over your nose all day long, we can just have a powder cold pack in our drawer and pull it out, and we put a couple spoonfuls in our mouth, and we try to avoid and or squelch any signs of the cold, so we do not have to suffer from colds in the future. It's such a waste of time. Yuxingcao is one of the leafy herbs that I use that is excellent for taking out nong. It's something like the yellow sticky phlegm or the green chunks that you have when you have cold or infection. So Yuxingcao is excellent for taking that heat out. And if it's pretty severe, for example, you have pneumonia and you're wheezing and the cough and the phlegm is so much that you cannot sleep, then we would want to use shigao, which is a rock. Actually, it's a mineral. And we would want to flush the heat out of you as quickly as possible. This works to help people have a bowel movement, and especially if people are getting constipated during the cold, like tends to be the case in the lung patients, Spleen Deficiency. The people with dry cough, then instead of having, maybe they have loose stools at the beginning, but then it might go to hard pebbles, or they may stop going to the bathroom. And that means that you have a ball of fire in your intestines, and it's going to further burn off the lung moisture. So this will help to just immediately, short-term, cleanse the large intestine of heat, and together with the zhimu, these can take down the amount of phlegm very rapidly. So these are more intense a little bit. If we want to treat the person with the Spleen Deficiency, the poor person with the dry cough that maybe lasts forever and ever, we might use yuzu, which we can also use in the common cold when people are experiencing the dry cough at the beginning. This will not create stickiness like other huangjing or sendi herbs may. And you can use this during the common cold or the long-term chronic dry cough. These moisturize the lungs and will help the person stop coughing very soon. If we have the poor people that have long-term cough and it's already damaged their kidneys and or liver, then we will know if we see the kidney liver pulse is weak. We'll put in some hanliancao and yuzhenzi, my absolute favorite herbs, because here in the United States we like to work ourselves to death, and all of that stress the adrenal glands cannot take. So usually half or more people that come in have already fatigued their adrenals, which we call the kidneys. It's all included in the kidneys in Chinese medicine. And so I often use those herbs, which are very, very gentle, to help when we work together with the diet to control people's symptoms. People that come in, we also will do acupuncture and or cupping for them. So we would use, depending on the different condition, we will probably take out some of the heat in the body. So taking out the heat in the lungs and the large intestine. We may use points like Hogu here, this point. A lot of people know this one. Or we may use points like Chu Chi to take out from the large intestine. There's Chi Zi along the lung meridian. Kong Zui, especially for those lung deficient people coughing out blood. And then down here, if they have the lung weakness, we might use Tai Yuan. And if they're coughing intensely, we might use Lie Que. If they have a sore throat, we might use Yu Qi. I try not to put the ones in the palm if I don't have to, because I know they're a little bit more sensitive. And then we might come down here on the bottom of the legs to show you some of the points. We might use Zu San Li or Shang Ju Shu, Sha Ju Shu, Feng Long. These are going to help the digestive system, the stomach, large and small intestines. And then if we need to, we might need to work a little bit more on the inside with Yingling Chen or Saining Jiao to help take care of that excess phlegm. And then if we need some kidney points, we might come down here with Zhao Hai or Rangu or Tai Shi, Fu Liu, depending on the condition of the kidneys. I also like to use some cupping for people, especially people that have fever. We can come back here. These are little cups that suck onto the skin. And if we use those here on Da Zui, and we come down at Feng Fu and Fei Su, cupping here for about 5 to 8 minutes will quite frequently help take down that fever feeling very quickly. If the heat is too intense, we have little lancets that we can do bloodletting on people. That may sound scary, but it's only a couple drops of blood. It's not scary at all. And we may let that out on Saosang or Sangyang. We may let it out on the back of Dazui, which is the meeting point of all the hot meridians. And taking that out will just release a little bit of the heat faster. People know that I love to use nutrition, and people that come to the clinic, I like to work with them to make lifestyle changes. None of the changes have to be made overnight, but for people with chronic coughs, they can be a lifesaver. And if you'd like to watch some of the other shows that I've talked about nutrition, you can find those on the Olelo program or look us up on YouTube. And I would just encourage you to learn a little bit more about the foods. My biggest avoids are wheat, dairy, and sugar. If you can start with those, you'll be healthier for tomorrow. Thank you so much for joining me today. I hope that you learned a little about cough, and anybody that you know that has cough in your neighborhood, please send them to your local acupuncturist, because they will be better for it in the long run, and hopefully they'll get even more advantages out of it. Their sleep will be better, their energy will be better, because Chinese medicine looks at the body as a whole, and we try to take care of everything instead of making you go to 20 different doctors. Thank you again, and until next time, mahalo.